Welcome to Progenesis Academy. For those who are not familiar with Progenesis Academy, we are a non-profit, non-biased program dedicated to providing education for the IVF community with a particular interest in embryology. Our webinars can be found on our website, Progenesis/Academy, or on YouTube channel, Progenesis Academy. Today's topic is managing IVF laboratory team. We brought an excellent panel of laboratory directors to help us understand the best practices in IVF laboratory management. We have with us Dr. Ivani. She is a senior embryologist at Reproductive Science Center. Dr. Swain, he is the corporate director at CCRM. Dr. Engel, she is the lab director at Generation Fertility Center. And Dr. Femer, he is the lab director at Poma Fertility Center. Thank you so much.
So I'll go through quickly on the topic of managing IVF lab personnel, focusing on training, competency assessment, and retention. And I do want to give a disclaimer that I am far from an expert on this. So this is why I agreed to participate, was I myself want to learn from the expertise and the experience of everyone involved, especially those on the panel. So, I'll just go through quickly some bullet points and some thoughts that I had jotted down as we, deal with this in our various locations. Our training approach varies. We do have a plan, but we have to remain flexible because this depends on the circumstance and the personnel who are being trained. So we have a protocol, we have a log to outline what needs to be trained and how many times you need to do it and how you track that for regulatory purposes. But the order and the timing changes by what the lab needs. And so one lab may choose to start training on one procedure before another lab, just based on their current staffing levels and where some of their pinch points or pain points may be. And this also varies based on the individual and the experience. And so there was a prior lecture not too long ago by Dr. Ivani and Debbie Veneer, I think, who talked about, if you're bringing somebody junior or mid-level or senior level. And so obviously that's going to impact the approach you take when it comes to training. Some labs are better able to train than others based on desire, based on staff numbers, staff experience. And so you do have to consider that. So basically it's not as easy as a one size fits all approach in most labs. And then also, something that I know many of our lab directors and I talk about is training can be difficult during the workday. And so some training, right or wrong, some training is done outside of the normal work day if you really want to make some headway. Some of this can be done independently, but to have somebody stop in the middle of a busy workday to train somebody isn't always conducive to getting things done on time when we're worried about quality. So, it's not unheard of for people who are training to come in before, stay late, come in on weekends to really make an independent individual effort to get that training done versus trying to squeeze that in on top of everything else that occurs during a busy workday. Some individuals train faster and slower than others, but in general, the approach is you start with the simple tasks and move to more complex. That's usually QC, paperwork, moving on to sperm prep and retrievals, and kind of getting a feel for the individual and how they're going to fit and determining your comfort level on how fast or slow to move, and which steps you can move with. And most people, by and large, wrap up their training with the more complex procedures, biopsy, ICSI, EGVIT, those that are technically challenging and sensitive. It's really hard to set a set timeline to this, but I think that there is an important component for that in terms of expectation. So the point I highlighted down here in the white box is, part of this, in my opinion, is setting expectations and giving feedback to avoid the trainee getting frustrated, thinking that, hey, it's been 2 months, I'm trained, I think I'm trained. Well, as the lab leader, lab director, if you don't think so, you need to give that feedback so that they're not spinning their wheels or getting frustrated. So, you can talk about tentative timelines and goals, nothing set in stone. Give progress updates, give guidance and feedback. And something that we had implemented in our labs is kind of a formal review or adjustment at set periods of time where the person can do this kind of passively, where it doesn't have to be in person if if you're trying to avoid confrontation or difficult discussions, whatever the case may be. But you can have a formal log or update in addition to that training log to make sure that you understand where the trainee thinks they are or where they want to be. You can give feedback as to where you think they are, where you want them to be, and set some tentative timelines. But it's clear that we don't force that. We're not going to say you are trained in 6 months or else. And then I put a couple links down here at the bottom from a sample checklist that AAB has provided, as well as a really nice write-up from Debbie Veneer and Kristin Ivani in a newsletter from AAB that talks about some of the training strategies. Competency assessment goes hand in hand with training. I think there's certainly a regulatory formal requirement. It's usually 2 times in the first year, 1 time a year after that. And most of us think of this when it comes to clinical lab regulatory, but we do it in our labs. And there's an observation component of this where you need to observe the employee doing, the various duties. And so we've created a checklist, and you can see a copy here of a pretty extensive one that an inspector in a very rigorous regulatory state had suggested we use. And so we did, and we adopted it and modified it to our protocols. But we do this in a checklist fashion to make sure that it's documented for regulatory purposes, and tried to check off as many things as possible. The key, as we said, is to observe, but also, from a practical standpoint, especially in the embryology lab, tracking and comparing outcomes to make sure that people are competent in terms of ICSI rates, degen rates, abnormal FERT, blast formation, non-fertilization rates, your vitrification and warming rates, embryo transfer success rates, biopsy rates in terms of no results. So tracking those on a regular basis is part of that competency assessment. And if there is an issue, taking corrective action as needed, and that can vary from reviewing SOPs to retraining or whatever the case may be. And so I think this is where a lot of people are probably interested in. I know I'm curious to hear what others say, but in terms of retention, and I put recruitment here as well, because I think a lot of these can fall into both buckets, retaining staff, but also recruiting staff. And so, first and foremost, pay. We don't want to beat around the bush here, but pay, especially now, is certainly, if not at the top of the list, pretty close to it. And so, the pay rate has obviously been going up, and most of us are painfully aware of that. But in terms of the model, hourly versus salary, is there a benefit of one over the other? And I'm asking because I don't know, because it seems as soon as we commit to one, somebody has a preference for another, and there's certainly pros and cons to both. Everyone always wants to know what benchmarks are, and there was a webinar a couple of weeks ago on SRBT and the salary survey, and most of us are probably handed that at some point in time when we were negotiating with staff. And the question always comes up is, how valid is that? It's a pretty low response rate from the data that I've seen in terms of the number of embryologists and lab directors out there. And so how accurate is that data? I don't know, but certainly something. It's an attempt to have a benchmark. At least from our perspective, we've got pay ranges across various states, and so it's a kind of a moving target for us, because certain states and locations just have different pay expectations and benchmarks than others. So again, kind of a moving target. There's a bonus structure. The question comes up, do you bonus based on quality of the outcomes or quantity, or some combination thereof to incentivize staff and to help retain them? And there's a mechanism of offering a retention bonus if somebody wants to leave, but that may be too late. They may already be upset enough or had another offer from somebody else that might be a little bit too late. So it'd be nice to be ahead of that to not have to use retention bonuses. And there's other bonus structures out there, but that's kind of coming back to pay. And then there's benefits. I know that we've got the limited ability to adjust our benefits. They are what they are. We can't kind of pick and choose what benefits staff get, but again, the white box here to focus on, what I think is maybe more important, is the work environment. How do we create a work environment to retain or recruit people? And that starts with the culture. We all are wanting growth. The field is growing, but focusing on outcomes as well. So good growth, not just growth for the sake of growth, and just really excellence. A kind of a culture of excellence that we do take pride in what we do. We do adhere to strict timings. We're not kind of making exceptions just to get more patients in and out. That we actually want to see these patients get pregnant more often than not. Managing schedules, easier said than done, because we know that that's impacted by factors outside of the lab, but workflow, people being on time, making sure that procedures are started, in a similar fashion, if not the same time windows from day after day, and not having something start at 7 a.m. one day and 10 a.m. the next day. Weekends, avoiding frozen embryo transfers and things on the weekends to lighten the workload there. Again, sometimes easier said than done, but certainly I would argue, part of that culture and improved work environment, doing team building exercises, showing tokens of appreciation, whether it's awards for employees on a formal basis or informal lab luncheons and things like that. It really does take a balance between the clinic and the lab. So if you want to work in the work environment, it's really hard to create a lab, culture of excellence without buy-in and collaboration from the clinic as well, because they certainly impact each other. So other things that staff like to see are clarity in the staffing model. What is the staffing model, and is the lab sticking to that, or is the lab understaffed, which most of us feel like most days? Having other opportunities and acknowledging those opportunities for the people who do the work. So research, opportunities to do lectures, working with staff who have an interest in publications, making sure they get abstracts and opportunities to present, but also acknowledging those people, not using them to do the work and then taking all the credit, which I know, happens in some locations. Continue education for staff. That's something that comes up routinely. Do we cover meetings? Can people get time off to go to meetings? Do we pay for certificates or licenses or various courses? And so that's something that can be done to help with that work environment. And then, the hard one that everyone asks about, is there room for advancement? And, this can be limited based on who's already in the lab, and it can be time dependent. If you've got a bunch of senior people who are still going to work for the next 10 or 15 years, it's hard to necessarily create advancement opportunities. But if there's growth, if there are some of these things like research and other opportunities, niches can sometimes be made. And there's other approaches too. And I'm curious to hear what the others on the panel have to say. And so I'll quickly fly through these, but retention, this is just something I put together because, again, it seems like everything is coming back to money, at least with the conversations I seem to have several times throughout every day. But if you assume that there's a similar cost per cycle, and this can be controlled. So I know it's not going to be exact, but a similar revenue per cycle. And again, this can be controlled. So it's not like one lab is spending, $5,000 more to do an IVF cycle than another lab. Dishes, cost what they cost. Pipettes cost what they cost. What we charge for a cycle can be adjusted. So these are assumptions I'm making that you can control that. So really, then how do you optimize the balance of money? Well, you have volume and growth, and maybe you put some money into marketing to drive that volume and growth. But you're trying to get more patients in the door to get more money. If you can't, if the direct costs aren't a major factor, you do have to control overhead, pay and salaries and impact there. Is there benefits of scale in terms of being able to leverage some of those employee benefits that they may like? But that comes back to maybe some of your direct costs too. But really, all this, what it comes down to is how much money is available for the lab in terms of retention or recruitment, and what can we pay them? And then the real question is, well, who decides how much money is available for the lab, and how do you divvy that up? And again, there's benchmarks and salary surveys, but ultimately there's got to be, as Rusty Poole used to always tell me, there's got to be beans in the jar to take beans out of the jar, and who's determining who can take beans out of the jar. And so then this is just a quick breakdown, at least in the US, of my view of things, in terms of who that person may be or those people may be. And it can vary by type of lab. You have a small private lab, MD or lab director owned. And so, is the MD or the lab director or practice admin who's determining how much money is for the lab and how much can be allocated for lab pay or retention endeavors. Large private centers, is an MD or lab director, or is there a CEO, COO who's determining? Or there's a university or hospital-based program. Is that a division or department chair or HR? My experience with the hospital and talking to colleagues who have worked in hospital and university-based programs, they're pretty restrictive. They're pretty tight in terms of their titles for staff. And at least early on, embryologists didn't fit in the mold of a normal med tech. And so getting, competitive pay or bonuses for embryologists still remains to be difficult. So, I would say of these, that's probably one of the most restrictive that I've been involved with. And then, there's networks and venture capital that we're all aware of with mergers and things like that. And again, is there a corporate lab director at the level, at the upper levels, or an MD or a CEO or HR that's controlling that? So, really the question is, who has more flexibility when it comes to controlling some of these funds and some of these decisions? Who has more capability? And is there one of these models that's a better fit for lab staff when it comes to some of these endeavors as we try to train or retain or recruit? Is there one model that lends itself better to that than others? And I don't know. I think all have their strengths and weaknesses. So I think I've gone over my 5 or 7 minutes, but here's some conclusions. The pay for the IVF lab has increased. We're all dealing with that. Workload has also increased. And so if there's increased pay and there's more staff, there's got to be a balance. That's usually more volume. We feel that it's kind of a self-fulfilling prophecy, never-ending cycle. More volume means more staff, means more pay. It's a good problem to have. We're all dealing with that. And if you add more money for the lab and lab staff, does that mean less money for somebody else? I think that's the balance that we all try to strike. Ultimately, what this means is there's a necessity for more embryologists. That's a good thing for us, at least for now, until automation kind of adjusts that a bit. But again, I don't think that means embryologists are not useful. It's just that we have to adapt our skill sets and become technicians or be able to fix automated devices or be able to troubleshoot and be ready for that. Rapid and careful training is important. There are emerging programs, so Debbie Veneer and Bill and others, EVMS and elsewhere, have some nice training programs, and these are, I think, a fantastic add to our field. There are some limitations. The training's always going to require some sort of on-site component to be tailored to your specific protocols. And as we said, retention becomes a big factor. And I always say this to people, is the grass always greener? That comes back to that culture. But, I know that my colleagues in the panel have run into this, where somebody leaves because they think it's so bad that it's going to be better elsewhere. And then unfortunately, those people find that that's not always the case. So thank you very much. And I welcome to hear any questions or the insights from our panel as we hear about the other lectures.
I direct several labs, like Jason does. Next slide, we'll move on right away. I have to admit, probably one of the things I hate to do most as a laboratory director is hire new people, because I found that probably, and I would estimate 50% of the new graduates, college graduates that I hire over the years have left the field, either while they were in my lab or later after they've moved on to another lab. So I think when you see that happen, you always worry that there's something wrong with the hiring process or the interview process. So whether it's our responsibility for that, my responsibility for that, or if it's the fact that this is a challenging field. I think it's challenging for a lot of reasons. I do think it's intellectually and emotionally rewarding, but we work long hours, most of us. We work many consecutive days, and there's not really such a thing as a guaranteed weekend or holiday off. I think all of those feed into what causes people to leave the field. I wish I had a better way to interview and to make hiring decisions. But if you go on to the next slide, Nabil, one of the things I think we've found over the years is that I have decided I like to hire people who are coming out of already trained or programs with some level of training, because I feel if they're willing to commit the time and the effort to go through a master's program at EVMS or CSU, they've got a level of commitment that goes above and beyond just trying to bring a college graduate in who thinks they're going to like this field but hasn't really worked in it. So we certainly, I certainly like to hire people who have been through EVMS or CSU, Colorado State University. I know a lot of the students at EVMS are often people who are already working in the field and want to go on and get a master's and move on to a TS. The CSU group is a little different. This is a residential program, so it's more like a traditional masters, and they do come out with a lot of hands-on experience at CSU, probably more than at EVMS for a new someone who's never worked in the field before. But they really don't come out with a firm grip on sort of the clinical aspects of IVF, although they have a great experience with learning to find eggs and do some culture. When we have people who are relatively new, what we like to do is get them the basics so they know how to pick up eggs, they know what to look for when they're doing an egg retrieval, and then we will send them to other places. Jason mentioned Debbie and Bill years program, Westworld Embryology, but we also have sent people to Tony Anderson's program in San Antonio to do some ICSI and biopsy training. Obviously, we're going to train in-house, and overall throughout the years, we've used a combination of all of these things. And often we use additional training, for example, paying an existing tech for going on to a master's or even a PhD program. We use that as part of the incentive package for retention. Next slide, please. But it's still hard. It's hard to pick. It's hard to train. And I think we all, at least what I tell my incoming techs is that unless they really have a firm background in some biological science and have handled embryos at some level, it's probably going to take them a couple of years to achieve competency and move through all of the levels of expertise that they need in an IVF lab. We do maintain training records, very similar to what Jason was talking about. I suggest to all of my techs that they maintain individual training records so they can take those records with them if they ever have to leave. I ran into a situation when I first tried to get my HCLD where the physician at the program that I was no longer with just would not sign off on the paperwork. And so I really had no tracking or documentation records to go around him in any way. So I always recommend to people that they keep their own personal copies. I certainly keep copies of everyone's training competencies, but I also recommend that they keep copies of theirs themselves. So we ask them to keep individual records of the numbers of ICSIs that they do, the number of strippings, the number of retrievals, etc. We also certainly maintain KPIs for individual embryologists as well as for the lab as a whole, but that's also one of our ways that we use for tracking competency. We have a form that has to be completed by myself and the employee that signs off on the individual procedures as they go through this. So it's, I'll ask them a couple of questions about what was in the protocol. I'll watch them do the procedures, look at recoveries, that kind of thing. So we document all of that on paper. We have a training competency form that we complete at the end. So we have a definitive date of completion for training, which makes it a little harder for embryologists. That's pretty easy to do for andrology or chemistry labs. We pretty much know when someone knows how to count sperm, but with embryology, like I said, it can take up to 2 years. So it will be a little more open-ended on that. So we will fill out training competencies at various points along the way. But ultimately, we want a completion of training that's filled out, a form that's filed, and then we want a 6-month competency and a 12-month competency, and then a 12 months from there on. Next slide, please. So those are things required by CAP and CLIA. I think, as Jason talked about, how do you, once you spend the time and the energy to train someone, how do you keep them there? And that's, I think, always a challenge. It's particularly a challenge for us in the San Francisco Bay Area because salaries are high, much higher than any place else. I have a lab, and a lot of that, what you have to pay them is driven by the competition in the area around. But one of the things we try to do is help support continuing education, master's programs. In one program, we're paying for someone's PhD. Well, in 2 programs, we're helping offset the cost of their PhD by paying for the PhD, but then they've signed a contract with us to continue working for X amount of time. It's different in the two labs after completion. There's, so compensation, as Jason discussed, can be very challenging, and sometimes it's out of our hands. Certainly at the University of Wisconsin-Madison, there's not a lot I can do about that. We're in ongoing and continual discussions, and people constantly push back on salary surveys, but it's really the only tool we have. And as Jason mentioned, it's very hard to get your HR departments at a university or a hospital to understand what an embryologist does that's different than what a laboratory technician. They won't even equate them to med techs. They want to equate them to just laboratory technicians that are running tubes and things like that at a much lower level. So that becomes very hard to try to convince people of the skill sets and the skill level of our technicians. We do maintain KPIs, and we try to build in bonus structures for moving up to being competent, demonstrating appropriate competency at ICSI and biopsy. But eventually, they're going to hit a ceiling. And so I think a lot of people go on and try to get masters and their TS certifications in order to find jobs elsewhere, which is really unfortunate. I think we all deal with turnover in the lab, sadly. All right, next slide, please. And that's it. I thought I had one more, but obviously not. So I just would do almost anything, I think, ultimately, than having to hire a new person and train them. I think trying to keep people in this field and help them feel like they're progressing and have a satisfactory work-life balance is the goal. Thank you.
Thank you so much. And our next speaker is Kristin Ivani.
Thank you, Nabil, for the invitation to speak, and to this amazing panel, Marlene, Jason, and Klaus, who have been through a lot with this. So as you've heard from the previous speakers, staffing is quite a challenging endeavor for all of us. So this is a really timely webinar. May I have the first slide, please? Okay, next slide. So when we're hiring somebody, this kind of little format went out, a little wonky. When we're hiring somebody, I think one of the most important things is we need to know what we're looking for. Are we looking for a newbie? Are we looking for a seasoned staff person? Are we looking for intermediate? Because each has its pros and cons. So a brand new person may be cost effective and enthusiastic, and you can train them just as you like them, but it is time consuming and requires constant supervision. A seasoned person may be quick to contribute to your workload. They can work independently and they can help train others, but they're expensive and they may be less flexible, and they may have style adjustments coming from the place they were before. And so the intermediate person can bring you some experience and some knowledge, and is open to continued development, but still requires some training. So I think it's really important to know what you're looking for and who you're going after. So you're not holding a new person accountable for what somebody who's an intermediate or seasoned person might know, and vice versa. Next slide, please. So when we're interviewing people, I try to always do a phone interview first. And, after doing this for so many years, you can usually kind of tell if the person is going to be a fit for your lab. So it really doesn't matter how much skill they have if they're not a good fit for your lab team. So I like to bring them into the lab on a busy day if possible, and then just watch them. Do they have spatial and temporal awareness? Do they know kind of who to stay away from and where to stay away from? Or are they asking the right questions at the right times? I also want to know, what does Fun Bobby do? Because this is a stressful job, and if you're no fun, you don't really work out for us, I think. I think it's important to have work-life balance, and I like to know what you like to do outside of work. What makes you a good embryologist? Not what makes a good embryologist, but what makes you a good embryologist? What do you find challenging about IVF work? And if they don't have something to tell you that's challenging, then they haven't worked in the IVF lab, I think. I do, if possible, like to leave them with the staff for a little bit so they can talk about us behind our back, you know, and ask questions that they might not feel comfortable asking me. And oftentimes they do ask the staff about scheduling and benefits and things like that. If at all possible, I really like to be able to have a working interview. If you go to the next slide, please. When it comes to training, I think doing an in-person interview gives us the opportunity to validate their skills. Learn the hard way that apples not necessarily apples. So somebody trained at ICSI in one lab or biopsy in one lab is not necessarily the same level of competency that I would expect in our laboratory. So I think, you know, having them, you know, spend a day or two and show you some things really helps out a lot, especially if it's a senior level person. I would not expect that of a junior level person, but definitely of a senior level person, because you're making a bigger investment. When we go through an orientation, we do this kind of walk a mile in my shoes where they go around to all the other departments and they just spend a little bit of time in the business office, in the front office, and in a new patient visit. And that gives them the opportunity to meet the other staff and kind of get an idea of what a cycle's like in our practice. It also gives the rest of the staff an opportunity to meet that person, which I think is really important. A good training program, and you know, Marlene and Jason alluded to this already, should have measurable goals. And you may not say, like Jason said, well, you better be able to do this in 6 months or else, but there should be some measurable goals. And there should be a training journal, and that allows for some accountability on the part of the trainee. They should be tracking information, not just us as the senior leadership. There should be regular check-ins. So that gives you the opportunity to check progress on a regular basis. All of our employees have a 90-day performance evaluation. And at that time, it's a good opportunity to review the performance ladder. Where are you? Where can you be? You know, where can you be 6 months, 12 months, 2 years from now in terms of skills as well as compensation? And as the previous speakers mentioned, there are training courses and centers you can send them to. We do prefer to train at our own center, but there are lots of opportunities for that around now, which is excellent. And Jason mentioned this a little bit. I call it prevent the rut. And you know, the best way to drive someone away is not to help them grow. And if they get stuck doing retrievals for 3 years, well, you know, that's not what they came for. So I think we have a responsibility to our staff to continue to train them, keep them engaged, and keep them excited about the field. Next slide, please. Can I have the next slide? Thank you. Competency evaluation. So competency is the ability of a person to apply their skill, knowledge, and experience to perform their laboratory duties correctly. And per CLIA and CAP, this is to be conducted at least semi-annually during the first year and thereafter at least annually. And it can be done throughout the year. It doesn't have to be done on this particular anniversary date, but you can coordinate it with routine practice and procedures during the workday to minimize the impact on workload. And it's important to note that training is not competency. Training is you learning how to do something. Competency is you demonstrating to me that you are able to do it. And the next slide, please. And I'm not going to go through this. You've all mostly seen this. If you haven't, you should commit it to memory. This is the CLIA's 6 steps for competency evaluation, how you actually monitor competency. So I left this in here for your reference, but we'll go on to the next slide, please. Staff retention. And this is a big one, avoiding burnout and boredom. Burnout from the people who are overworked and boredom from the people who are not being kept busy and engaged. We need to recognize and respect and acknowledge that people have a work family and a home family. And boy, if COVID didn't drive that point home for us, nothing else would. You know, we understand now better than ever how what an impact our work has on our staff at home. Giving staff the opportunity to interact with other departments so they're not just isolated in the laboratory. And this can be, like I said, during orientation. This could be fun activities like ice cream socials or lunches or things like that. You know, to continue to provide technical development opportunities within the laboratory for the staff. Again, previous speakers mentioned competitive compensation for your area. We also are in the San Francisco Bay Area, and it is a challenge. I think it's a challenge everywhere, but you've got to be competitive or you're going to lose good people. Providing opportunities for staff to go to seminars and conferences, doing staff engagement survey, and we'll talk about staff feedback in just a minute. Jason hit this point pretty well. Benefits are not always flexible for us. We are limited, but should be able to offer a 401k. Perhaps your clinic can offer a bonus or profit sharing, maybe discount tickets to movies or other local attractions in your area. One thing that I found to be super helpful for us over the last few years is flexible scheduling to keep good people. You don't want someone to leave because they can't work around the schedule. And, you know, I'd rather have a little bit of that person than none of that person at all. And so if you can be flexible, I would urge you to try. And then finally, some team building activities. And, you know, these are kind of hard things to do. They take a lot of effort, but I think worthwhile in the long run. Next slide, please. Employee feedback is super important, and this can help you understand the employee concerns and help resolve issues both within the lab as well as the organization. Feedback helps keep employees and management on the same page, and employees do feel respected and valued, that their feedback is being heard and acted upon. And, you know, if we don't act upon it, it's a reflection on us. It's not a reflection on them. We need to collect data because real data drives change. And so if we do this in a formalized manner, maybe some type of employee engagement survey, then the staff are going to respond better and we're going to get better information that's going to be more helpful. Next slide, please. And alas, unfortunately, there are those times when people just don't work out. So you got to know when to hold them and when to fold them. And I think, you know, the first step here is setting clear expectations. What do you expect of this employee? Provide regular and honest feedback and provide fair treatment for everyone. Listen to your staff. If your staff come to you and talk with you about an employee, listen to them, because they're not complaining and just whining. They actually have legitimate concerns. Again, then it's a reflection on us if we don't do something about that. Provide a performance improvement plan for that employee as necessary, and meet regularly to discuss that. Have regular performance evaluations. No employee who's ever terminated should be surprised. As such, no employee should ever be surprised to receive a poor performance evaluation because you've been communicating with them all along. Next slide, please. One thing you can do, and staff feedback helps with this, is periodically review processes that can increase lab efficiency without sacrificing happiness. You know, maybe you want to talk about batching or doing series or not working that way. Schedule lab team shifts. Think about things that might save time and energy in the laboratory as well as risk. No day 2 checks or day 3 checks. No hatching on day 3 before biopsy. You know, move to a single step media with no changeovers. Be sure that you have some administrative help so your embryologists can focus on being embryologists. And really support good communication between departments. You know, are the orders clear? Are they on time? Are they accurate? And make sure that the treatment plan is clear. And this helps your embryologists be more efficient and be more focused. It also leads to more successful risk management. Next slide, please. And I left this for last because I think this is one of the most important, perhaps the most challenging, but the most rewarding thing that you can provide for your staff, and that's a company culture. And the culture's reflection of the attitudes, beliefs, values, goals, and other characteristics that the organization follows to create a gratifying work environment. And I am so fortunate to have the most incredible medical director in the world directing our program, and a group of physicians who respect the laboratory and they sincerely appreciate the laboratory team. And I am so, so grateful for that. I think the company culture can be introduced during the interview when you first meet with your candidate. I think it should be reinforced during orientation, and it's something that you should be living each day. You know, honesty, integrity, dignity for the patient, transparency. Give credit where credit is due. And like I said, our physicians definitely do that. But I think we in the laboratory need to do that for each other. We need to practice patience, grace, appreciation, and kindness. This is a difficult job, and we need to be patient with each other. We should celebrate the victories when somebody attains a competency or they get their first pregnancy from their first embryo transfer. It's a big deal, you know, it's really exciting. I think we need to lead by example. And I think we need to find ways to make the craziness fun. I mean, who wouldn't want to work with this bunch of weirdos on this slide here? And this is a Halloween, it's holiday party. It's that picture and looks like in labor and delivery is actually our holiday skit that we did. You know, the picture on the left is getting involved in National Infertility Awareness Week. All these things are fun. They bring people together and they give an opportunity to interact. And the last slide, please. You know, whether you like Steve Jobs and Richard Branson or not, I do appreciate both of these quotes. It doesn't make sense to hire smart people and to tell them what to do. We hire smart people so they can tell us what to do. And Richard Branson says, train people well enough so they can leave, but treat them well enough so they don't want to. Thank you.
Klaus, thank you so much.
First of all, I want to thank Nabil and Progenesis for inviting me to this very timely lecture series. And above all, I want to thank my colleagues, Jason, Christine, and Marlene. It's such an honor and pleasure to be on this panel with you all. It's just really great. Thanks a lot for letting me be part of this. So I'm going to talk about similar topics in kind of more or less the same way, and maybe hit on some different points. First slide. So I'm the lab, there we go. So go ahead and go to the next slide. We'll save some time. So let me talk a little bit first about our hiring processes and training. And let me also give a disclaimer here. I am by far not an expert at this. I've been doing this since about 1988, and things have really changed a lot from then to now. But these are some things that have kind of worked out for me in the long run. I agree with Marlene in that a lot of people who get into this field do not complete it. They'll only about 50% of it will go all the way, you know, and make this a career. So kind of what I've tried to do with it is to try to hire people if they're fresh out of school. We've had really good luck with animal science, agriculture majors, or biology majors. And the people that have been able to process college, figure out that this is what they want to do and actually make it happen, all tend to be people with personalities or life experiences where they had to finish something or they had some grit. For example, they had to work 2 jobs to get through college, or, you know, they spent the summers, you know, working in Alaska, working on a fishing boat, or they grew up on a cattle ranch, you know, where they work, you know, dark to dark, you know, 7 days a week. In other words, that person has grit. That person has, you know, a good backbone, because we really feel like we can teach embryology to pretty much anybody if you have what it takes. So that's kind of how we feel with either fresh graduates or even people that have got intermediate or advanced training. Do you have what it takes to fit into our laboratory? As far as how do we train, really when we begin to train someone, what we do is we ask them to read extensively. We try to remind them they're an embryologist. That means they're a scientist. We don't want them to memorize why they're doing their protocols, but we want them to understand why they're doing what they do. So typically it starts with reading extensively. You would shadow a staff person, and then you would start to perform those tasks under supervision. And you would start, of course, you know, with your least complex task and then move up as that person shows competency. So really we would, when you demonstrate competency in one task, then you would kind of move to the next so that we don't set you up for failure. And so then Christine did a really nice job of discussing competency assessment, so I won't go too much into that. But basically what we do here is we do a 3-month review, a 6-month review, and then it becomes an annual review. And what do we look at for staff? What we do is we compare the outcomes of each individual, whether it be your fertilization rates from ICSI, your degeneration rates, or how well do you grade embryos relative to other staff members? How often do you have reads or no reads when you're doing embryo biopsy? Some of the things that Jason hit upon. And so what we do is we compare that person to the other staff, and then we compare you to the lab average. And based on that, we will either do remedial training, or we'll try to come in and figure out where some of the shortcomings are to improve your outcomes. If everything is going well, then we just continue to add, more complex skills to your repertoire to learn new skill sets. Next slide, please. So a lot of discussions have been about that. Just a little bit so you know about our clinic. We're about an 800 cycle a year program, so we're owned privately, and so that's really easy for me to kind of keep an open door policy, in that I'm at work almost all the time. It's just the way I'm wired. And I think that's probably how everybody on this panel is, that we're at work all the time. So that really means that you can have an open door policy for people. And you want to be inviting to your staff so that they can always talk to you, which really means that you have to provide an environment that fosters feedback and discussions. And one of the things that we try to tell people all the time, it's okay to make a mistake as long as you share with your colleagues and the team that you made these mistakes, because we're going to use these opportunities to improve. We often will use examples like, remember when you learned to ride your bicycle, you fell down and you skinned your knees a few times. Well, when you're learning to do ICSI, it isn't going to go perfect every time, and you're going to skin your proverbial knees now and again, but you got to get yourself up, dust yourself off, and know that you've got a lot of team members and players behind you that are going to help you. Which really then leads to the next point, is that you've got to provide a mechanism for staff to express themselves, either in a group setting or one-on-one. And often people feel better expressing their feelings in front of the group. Others want to do it one-on-one. They may want to talk to the lab supervisor or just one of their colleagues, but try to put into play an avenue so that person can speak out. And above all, in today's age, you really need to talk to your staff and listen. Things have really, really changed a lot. Back in the old days, people kept very much to themselves. We didn't have a lot of discussions about what's going on in your life, what was going on professionally and personally, but now that's really changed a lot. Really, the idea that we take now is, Christine says, is we have two families. We're your family here at work, and then you have your family when you get home. Next slide. So how do we improve staff retention? How do we get people to stay in our clinics? And everybody's hit upon this. We pay above average here. Well, what is average? And this is a huge question mark, because I frankly do not believe in the ASRM or the SRBT, or I should say the salary surveys that come out. I feel that very few people answer them, and they're already 2 years behind by the time we get them. So typically what I do to find out what salaries are is I reach out to colleagues who run similar type IVF clinics with similar success rates, have an academic environment like we do, so that I can compare up and down, say, the West Coast, what salaries are being done. I'll reach out to friends in Texas and the East Coast and kind of come up for an idea of what salaries are. And then in general, we're going to pay a little bit above that, because we don't want money to be the thing. Remember, staff turnover costs you way more than paying somebody $2,000 or $3,000 a year extra. And so from the very beginning, we provide a very clear pathway for professional improvement. And that pathway is adjusted for the individual. In other words, a person who aspires to be a lab supervisor, their pathway is very different than someone who's just trying to figure out if they like embryology. One of the things that we've learned that really seems to help a lot, though, is assigning ownership to people very early on. So, for example, putting a junior embryologist in charge of embryo ship outs and ship ins really gives that person a sense of ownership. And then when they get that dialed in and that program is working really well, then that embryologist feels like, hey, I started this, I've set this up, it's working really great. And so really provides a sense of ownership and entitlement that comes with that ownership. And like I stated earlier, treat everybody like family. I personally feel that if you're the lab director, you have to lead by example. That means if the toilet needs unclogging, you unclog the toilet. If stuff needs restocking, you restock it. If it's a really ugly job, you jump in and do it, whether it's aliquoting media or cleaning the lint off of microscopes. You have to lead by example. And Kristin made a great example of this is make work fun. We listen to music in the lab all day. We tell highly inappropriate jokes all day, because after all, we work with eggs and sperm. Dude, what greater material do you need, to have Comedy Central in your lab? So we try to make all this madness really a lot of fun. And then one of the things that I've learned over the, going on 30 years now is that staff don't leave centers where they're paid well, treated fairly, and can improve. But more importantly, if they feel like they're part of something bigger than themselves, generally those staff only leave because, say, a significant other has been transferred or an opportunity of a lifetime has presented themselves. But if we can have all of these mileposts in place, treat them fairly, a pathway for improvement, and make them really feel like they're part of a team, my experience is that people don't leave that often. Next slide. So what about managing people and handling complaints? We rotate duties all the time so that no one person isn't being stuck with, say, egg retrievals and things like that. We try to rotate those duties as people have shown competency. And I've stated this earlier, as a lab director, I tend to be the first one in. And if there's extra work, or if I've got to come in on a weekend, to pick up the slack to maintain the work-life balance of my staff, I will gladly do that. In fact, I'm the guy who's always on call on weekends just to make sure that my staff can keep their weekends free, or it doesn't become a super stressful situation. And the other thing that I found is don't force staff to perform duties they're not comfortable in. So even though somebody could technically be signed off on doing ICSI and you feel that they're uncomfortable, don't make them do ICSI on 30 eggs. Rather, split the case with them. They do 15, you do 15, and show that, hey, you did it. So next time you do 20 and work your way up to those 30 eggs, for example. And maintain a work-life balance for your staff. And many times that means the sacrifice of the lab director or more senior staff. And something that I've had to learn a lot over the last few years is to take complaints really, really serious. People in the old days just didn't used to complain. They were really thankful that they were embryologists, that they weren't mucking stalls or streaking pus out on auger plates. And now things have really changed. We have a new generation of people. And so now we really have to talk with staff a lot more, to pay attention. And I've really learned now almost to learn how to pick up on the vibes and the moods, because that's going to let you know much earlier that things are not going very well. So work together on an action plan, do it, and then follow up on it and make sure it's working well. Next slide. And this is my last slide, and it is, I think, is the most important thing, is the company culture. We've all hit on this directly or indirectly. Company culture ultimately determines how satisfied staff are going to become and how successful you will be with your staff overall. And one of the things that you've got to remember is you're only as good as your staff. I try really hard to hire people that are smarter than myself, people that are going to bring things to the table that I don't have, because I know that as an N of one, I lack many things and I'm good in just at a few things. So if I have a company culture where we're embracing each other, whether it's coming over to my house for barbecues and having a few adult beverages, to go into the movies together, to just do these things that really embrace the team. Now, I'm I know that this is probably hard for someone like, Jason to do, because as your practices grow bigger and you become a victim of your own success, and you now have multiple laboratories or satellite offices, this ability to keep this embracing environment becomes difficult. So in conclusion, I know this is the third time I say it, so I mean it, is that as a lab director, lead by example, don't assign tasks to others that you wouldn't do yourself. This goes a really long way, especially in today's culture, because so many people today, unfortunately, coming out of school will say, I'm not going to do this, I'm not going to do that. But if you take that away by doing it yourself, they lose all their argument. Talk with your staff often, and by all means, make work a really fun place. Thanks a lot.
It's very challenging to really manage employees in the IVF industry. There is a lot of competition, in terms of hiring. And a question I have about what makes IVF slightly differently from other jobs is that the training takes too long. You get someone that is new, it takes them years, or 1 year or two, to just start biopsying. How do you guys handle the expectation of new incomers that just come and then they're expecting to jump into a biopsy? I'll start with you, Klaus.
Well, that's a great question. When we interview people, we tell them right away, it'll probably be 2 years, 1.5 to 2 years before you're working in a weekend by yourself doing everything, from A to Z. But the way I discuss it is, but you've got a lifetime. So 2 years is nothing to dedicate to, preparing yourself to do a lifetime of amazing work and giving back to others in a manner that embryology allows. So I think a lot of it has to do with the way you say it. I remember when I interviewed for a job one time, they said, it's going to be 2 years before you do anything. That was very different when you're just putting 2 years into this. You're investing 2 years of yourself into yourself. And so when you say it like that, it's like, okay, I'm going to put 2 years into this. I'm going to get myself in a position where I'm doing everything on my own. And that pill, although it's jagged, it is a little easier to swallow. But I think it can be hard for a lot of people, because more and more people today want immediate gratification. Like, where's my corner office? Where's my 6-figure salary? That kind of stuff. And things have changed a little bit.
Yeah, absolutely. Thank you so much. Jason, what's your experience with this expectation?
Yeah, it's tough, especially when we were just talking about balancing, the extreme need we have with the volume. And listen, I mean, I think everyone on this panel would agree. We'd love to get people trained as quickly as possible, because it makes everyone's life easier, keeps them happy, because everyone does have these expectations of go, go, go. Hey, I want to do ICSI, I want to do biopsy. That's sexy. That's exciting. But kind of going back to that culture idea, hey, we want to be successful. We want to set these people up for success. And as any of us who have, been in the field for any amount of time, and certainly I'm the most junior person on the panel. And so I'm sure the other speakers could have some interesting stories, but, a mistake in our field can be devastating. I mean, it can be career ending in terms of bad reputation, but also just personal turmoil. Hey, I made a mistake, flipped a dish, whatever. And so slow and steady is the mantra for a reason. I mean, we're kind of a zero defect environment, right? So I think trying to make that clear to people, maybe, relating to them, giving some feedback or some stories to try to temper that desire to go, go, go. And because they want to help their team members, they want to be trained faster and, get a bump up, but they also want to help their team. They see the push for volumes and the stress and everything. But, a lot of times, even though some may not believe it, it's in their best interest to go slow and steady, because you want to learn how to deal with things. You don't want to rush through it. And so that's why, I know I struggle with HR sometimes, where if an employee complains, hey, I'm being singled out, I'm not advancing as fast as I should be done by now. And I said, that's a slippery slope. You start putting a mandated timeline on this. I can't do a week shadowing, take an exam and say I'm trained. in embryology, because then if your ICSI rates are horrible, nobody's happy. And who are they coming to, right? They're coming to the lab director wanting you to fix that problem. Well, how do you fix that problem? So all of that's kind of interrelated. So slow and steady, trying to set those expectations, making the employee realize that it's in their best interest, because this is a lifelong career. It's a small field. If they do relocate for one reason or another, you want to have your good reputation, your good outcomes. Word of mouth among lab directors is a big thing. And so if you are a valued employee, if you are good, I can speak firsthand, how I got into the field. It was word of mouth. And so you do want to protect your reputation. I think going back to that family theme, your lab director does have your best interests in mind, and they don't want to see you fail and have a potential career ending issue in the laboratory by trying to rush through things.
Yeah, thank you so much. Kristin?
I think some of this you can vet out during an interview potentially. People do need to understand that it does take a long time to become fully trained. But there's so many little rewards along the way that if they're patient, they'll get those rewards, some financial, some just personal satisfaction in what you're doing. I mean, how many jobs are there where you can say, I made a difference, the biggest difference in someone's life that you can make by helping them have a family? And, I like for people to take the time to think about why they want to be an embryologist. What do they understand about embryology? What is it? Do they understand what they're doing? And I think, both Jason and Klaus and Marlene have done a lot of training in their years, and some people aren't really cut out for it. And I think it's okay, for those people to make that decision, or for us to make that decision for them, unfortunately. But I think for the most part, I think we have a responsibility to be honest about what it takes, but to make it realistic so they can achieve the goals. So they shouldn't expect to do, biopsy 6 months after they get out of college. It just takes time. But to celebrate the victories that they do achieve, the first time they do a retrieval and sperm, and even making dishes, I think oftentimes we relegate making dishes to the least experienced person on the team. But it's probably one of the most profound things that we do. And if we screw it up, it's irreversible, So to instill in them the importance of every single thing they're doing, I think really helps a lot, that they are contributing, even if they feel like, well, I wish I was doing ICSI or biopsy or transfers or whatever. Every step is super important to the patient's success.
Thank you so much. A question came from Aaron. He was asking whether it would be a good idea to have management handle the relationship between the physicians and the embryologists, to have someone in between. IVF, if you take Jason's maybe company as an exception, or large ones that have lots of management in between, most of the clinics, there is a direct contact between the physician and the embryologist. Is that a good model in this practice, in IVF practice, Klaus?
It's the only model I've ever really known. I mean, even when I was consulting and worked overseas in really large, like, 200 cycle a year, a 200 cycle a month retrieval kind of clinics, the position that I had, the physicians always came directly to me with issues and any of that kind of stuff. We didn't really have a buffer. So I don't really know any better than that. And the reason why I mention that is because if, say, the physician went to the practice administrator and said, hey, can you talk to Klaus, about his music? It's too loud in the lab. That's one thing. But it's a different thing if the practice administrator has to come in and talk to you about, we're kind of having a problem with this degeneration rate with ICSI. Bob he's a great guy, but man, his degeneration rates are about 15%. The practice administrator is going to talk to that person, then ultimately it's still going to fall on my lap to fix it. So I think what you have to do, though, is change how you discuss that, though. In other words, the doctor may come to you in a totally unfiltered manner. We've all been there, and had somebody come and tell us a lot of stuff. We have to digest that, turn it inside out, and then think about how we're going to talk to that person, because we really have to serve as that intermediate.
Thank you so much. Jason, you are in a position maybe to answer this question. Does
Yeah,
management...
I'm not really, I agree with Klaus. I'm not really a buffer. I actually, if the doctors ever do contact me directly, my immediate first response is, have you talked to your on-site lab director? Because, you know, again, to kind of be frank, I'm not going to be the end around. Ultimately, that local lab director, that local lab lead is the one responsible. And so if I'm the on-site lab director, yeah, they're coming to me, and then I can talk to the staff or get feedback. But if I've got an on-site lab director, which we do in most of our locations, the doctors aren't coming to me, shouldn't be coming to me. They should be going to their on-site lab directors, because they're the ones best suited to be able to know all the details of the case. They know their staff the best. And my role, quite frankly, is in support of the lab directors. I always tell them, listen, I'm your high-paid assistant. I can go out and try to recruit. I can fly in as a traveling embryologist. I can help do regulatory. What do you need me to do? And so that's really my interaction is more with the lab leads. That's our model, because, and again, I to be frank, you know, the lab needs to operate tomorrow if I get hit by a bus. You know, to me, a manager or director on site is the buffer with the physicians. And that's not to say that, you know, the physicians or nurses can't talk to other people in the lab staff, but, you know, there is an org chart and a hierarchy for a reason, to make sure that there's consistent communication, consistent information given. And if there is an issue, that it is being troubleshot and presented accurately, and you're not getting misinformation and something spiraling out of control.
Thank you so much. Kristin, what do you think about this? And I'm going to add one more component. You guys work with embryologists every single day. Is that a good practice to also be the one that handle the disciplines and all these things, or should be someone at the organization that take care of that?
Well, you know, my situation is similar to Klaus, but I'm also, you know, I've worked with our medical director longer than I've been married to my husband, so it's probably a stranger situation than most. But I think that, you know, we have an immense amount of respect for each other. We sort of grew up and grew the practice together, which I think makes it unique, but it's a lot of work. You know, it is almost like being in a marriage, you know, it's a lot of work from both sides. And, you know, we would meet on a regular basis to review things. As the practice got bigger, we didn't meet as often, but that relationship is still always there. With regard to the discipline, you know, well, all that being said, our physicians, you know, when I interview staff and hire staff, I tell them, you know, you are a representative of this laboratory, and any physician should be able to get the same information about the laboratory from you as they should be able to get from me. You know, which embryo should I pick, which, you know, what's going on with this egg quality, that sort of thing. But, you know, the buck does stop, in my opinion, with the lab director, and the lab director should be somewhat of a buffer between the physicians and the lab. We also have physician champions, as we call them. You know, one works with third party, one works with the lab, one works with the business office, and that prevents, you know, 7 physicians coming to the lab director, blah, 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 you know, it's one person, and they speak with one voice because they communicate really well together. And with regard to discipline and evaluations, I don't think anybody should be doing that except the lab director, in my opinion, because that's the person most familiar with the work. I don't think that a practice administrator or director of operations or anything like that can be doing disciplinary action or evaluations or training or whatever for a laboratory person unless they work directly with that person.
Yeah, thank you so much. The reason I asked you was to find out if university environments handle embryology management different from private companies. What's the difference?
I can make a comment until Marlene gets her audio back. But, you know, I think the lab director, you know, the on-site person is going to be the best situated, as Kristin said. But, you know, I think all organizations have a bypass if needed, you know, if the conflict is between the lab director and the staff. I know from a company standpoint, HR standpoint, we have a hotline that people can basically bypass the local lab director to call an HR if there is something that I guess is against that lab director. But in terms of something in the lab, how to address an issue in the lab, low rates or whatever, the lab lead, the lab director. If there's some sort of HR personnel issue, the lab director may not be the best person equipped to handle that. And trying to address it, they could make it worse depending on the circumstance. So, I think there is a role for HR for certain things. But, again, my personal opinion is too many avenues, and it muddies the waters in terms of that hierarchy and that org chart. And so if people can just freely bypass the person in charge of the lab for complaints or whatever the case may be, I think that's a sticky situation.
I would completely agree with Jason on that HR most definitely has a role when you get into a conflict type of situation, that they can be more of a non-biased third party, whether the employee goes directly to them or I've met together with HR with an employee regarding something. So absolutely, that is a good way to go.
Very good. Marlene?
I'm back, I think. Can you hear me?
Yes.
Okay. Oh, sorry about that. I had to move because I had a policeman stop me in the airport. Oh boy. All right. I think I'm okay now. So I have worked with a very good HR department at the University of Rochester, and they've been very involved in being a resource for the laboratory. So I feel like even as an offsite, I expect HR or the physicians to go through me when there are personnel issues. But then I've also worked with an HR department. The one in Madison is pretty remote and does not have much role in what we do. So they've not been very helpful at all. So we have on-site management that is kind of remote from the university's HR department. And so we work with the on-site people, not really with the university HR. But I've always felt like I was the advocate for my staff.
And
that anyone who had a problem with my staff should come through me.
And would you say the university are more equipped for having this type of managing laboratory staff, or the IVF private sector has better approach?
I think it's really dependent on the people. I mean, at Rochester, yes, I would say that's the case. The university HR is much better equipped. I have had really no constructive interactions with the HR department at Madison. In private practice, I really think it depends on the practice manager. Some of them are very good and others are not. So I think it's very difficult to draw a broad brushstroke and say, a university practice is better than a private, or in terms of HR, or private practices are better. I've found some good, some bad in both. And you have to, I think, really learn to work within the constraints of the particular program you're associated with, because they're also different.
Yeah, thank you so much. We are getting closer to the end of the webinar. One more last question. Just from you guys, a take-home message for those embryologists who are aspiring to be, one day experts in the field of embryology. What do you tell them as far as expectation and how to handle the work? And I'll start with you, Klaus.
Well, a best way to know if you're really going to like embryology, is I can only relate to myself, is if you look at an embryo and you just go, wow, this is it. This is the whole thing. I'm willing to work for free. I'm willing to sleep in my car. I'm willing to do whatever it takes to get an opportunity to be a part of that. So if you can have people that have that internal drive, then you as the lab director and business have an obligation to provide really fertile grounds. You need to be like a garden plot. This person is a young seed that you're planting, and you need to make sure that you nourish and care for that person. So if you're going to become an embryologist, you have to realize that you're going to have to work really hard at this. You're going to have to dedicate a lot of time to this. But it's one of the most amazing things you'll ever do. When you get your first fertilization and your first pregnancy, and you get to see the baby that you helped create, that's the most amazing feeling. And remember, that will carry you through hard times when you're really down on yourself, or you're on your 12th day that you're working in a row. Because, I mean, we all have to give, you know, in any field to do really, really well. So just buckle up and ride, because it's a heck of a ride. It's a really great profession.
Much, Kristin?
Yeah, it's pretty amazing. I mean, I never get tired looking at embryos in the morning, and I think to share that passion with somebody and bring that passion out in them is it's so exciting, and you want someone to love it as much as you do. You know, they need to understand that they have to be patient with themselves, but to be in a place, you know, that is fun, that where you do feel supported and where you do feel encouraged and where you have an opportunity to grow. And I'm not talking about just financially, because it really is not all about money. It really is about you loving what you do. And I'm not sure that, you know, many people would do it for nothing or would sleep in their car to do it. I'd like to think that, but at least that they are in a place where they can grow and they can be passionate and be excited and feel supported and have fun.
Thank you so much. There have been a generational change, and I'm sure you guys have noticed that the younger people now have just different perception of what to expect and how to progress and how fast. You know, Jason, what's your take-home message for young embryologists?
Yeah. I mean, true story, Klaus. Rusty Poole made me sleep in my car for 2 years down in San Antonio. So that you guys must have a similar mentality, philosophy with that.
That's how Texans are, man.
Yeah. I would say that, really you have to kind of get your preconceived notions out of your head. You know, it's kind of this, I'll use the word again, this kind of sexy field, and even especially with the animal science background. I love Klaus's comment earlier about that animal science background. I think that's where most of us came from. And that's really an invaluable background to have to understand the science and the physiology. But you kind of have to throw some of that out the window in terms of, just the immense difference between working in a research lab with, 200 mouse embryos and a human embryo. And I know with some of the valuable cattle and things that Klaus has worked with, it's probably, not as different as the labs I had come from, where it was pig embryos or mouse embryos. But coming into the lab, especially now with these master's programs and things where people do have a pretty good knowledge base, but you have to throw some of that out the window and understand that you really are kind of starting from scratch. You're dealing with a handful of embryos here. Simple tasks become much, much bigger. Walking across the room with a dish in your hand. All of a sudden, you got to stop and consider what you're actually doing here. You can't just zip through and oops, I splashed some of this, or oops, I made the dish wrong, as Kristin said earlier. So I think, be humble, get rid of preconceived notions. That doesn't mean don't learn, don't use what you know, but kind of take a step back and listen and learn and take your time. Don't rush, and good things will come to you if you listen to the team around you. So
thank you so much, Kristin.
Or Marlene.
Marlene. Kristin, you already spoken.
I think for me, the take-home message I would give to anyone who wants to become an embryologist is learn. Read the field, get educated. But I also agree with what everyone here has said. You have to love this field, because I think you give up weekends, you give up holidays, and it can be hard. And I agree with the comment about, you know, the lab director has to be the one willing to take out the trash. And I've done laundry on Saturday afternoons for the clinic. I've taken out the garbage. I like to think I've done all the scut work, but it's paid off, because there many times I've said, as I was headed to work, I don't want to go to work, but I'd rather be going to the work that I go to today than be going to Staples, for example. So even when you're having bad days, which thank goodness are few and far between, because generally I have loved the opportunity and I've loved what I've done over the last 35 years, and I'm so glad I had the chance to do it. But for new people coming in, you have to be willing to put in the hours. You have to be willing to read at home, figure out where we've been, think about where we're going to go, and be creative.
Thank you so much. Well, we are coming to the end of the webinar. If I may give you guys a minute just to introduce your practice or interest, and I'll start with you, Klaus.
My name is Klaus Femer. I'm the lab director here at Palma Fertility here in Kirkland, Washington. If you ever want to come and visit, reach out. We'd love to have you visit. Thanks a lot. It was really a pleasure to be on this. Really great to see old friends, Kristin, Marlene, and Jason. It's an honor to hang with you guys. Thanks.
Thank you so much. Jason?
Jason Swain. I'm the lab director for CCRM Fertility. And as I said earlier, really, we're founded on 11 different labs with 11 different lab leads, lab directors. So I wish I could go through and introduce all of them, because without them, our labs would not be as functional as they are.
Thank you so much. Kristin?
My name is Kristin Ivani. I am the former lab director at the Reproductive Science Center in San Ramon, California. And yeah, it was a great opportunity to participate with all of you. I really appreciate that. Thank you. And what a great job.
Thank you so much. Marlene?
Thank you. I'm Marlene Angle. I direct the laboratories at Laurel Fertility Care in San Francisco, Caperton Fertility Institute in Albuquerque, New Mexico, Carolinas Fertility Institute in Winston-Salem, the University of Wisconsin, Madison, and the University of Rochester, New York. So thank you for having me. It's always great to be with this group of people. Thank you.
Well, thank you so much. Thanks, Klaus, Kristin, Jason, and Marlene. Thank you so much for your input. Next 2 weeks, we will have another webinar. We will announce the title in a day or two. So stay tuned, check your email, and I will see you soon. Thank you so much. Thanks, guys.
Thank you.
Good night.
Thanks, everyone.
Bye-bye.
Night.